Hi guys, this is Shamima from the YouTube channel Doctor to Help. This channel was started about 3 weeks ago to provide general medical education. You would be happy to know we have had more than 1,600 views in just over 3 weeks. So I'm very happy. To celebrate this week, we are going to start a lottery game. We are going to select 2 winners on January 16th. The end of entry is at midnight on next week Saturday. Please watch this video, leave a comment, make sure you're subscribed so you can enter this competition, and we'll select 2 winners. And the first prize is going to be this, and the second prize is going to be similar to it, just a little bit smaller. All right, and we'll try to do this every month. All right, so without further ado, let's start today's discussion. Today we are going to discuss how to reduce our medical bills. Nobody has spare money, especially not in this pandemic. How can we reduce your bills? As a provider, I always try to save you money, especially for my patients. So, first thing is prescription. If you don't have the GoodRx app, please download it on your phone right now. What it will do is show you, if you enter on the top, the medication, look for generic, and then search. It will show you all the different pharmacies with that medication and price, and there's a coupon attached to it. Click on the coupon, and that's the price the pharmacies will try to give you. Walmart always matches the lowest price. All the other pharmacies, they're competitive. They're all trying to get into this competition and win. So talk to your pharmacy. If they don't have the best price, talk to them before you switch a pharmacy, because sometimes the pharmacist will have a coupon that will match to bring that price down. Even if that is not enough, go to the pharmaceutical company website. There are coupons that you can download from there, and they can even have free trial period that you can use, and that can also be used as an advantage. And of course, if you have a primary care physician, don't forget to ask if they have a sample for you. All right, so that's prescription. Second, I want to talk about lab test. How can you save money on lab test? There are multiple places. Can you do lab test without a doctor's prescription? Yes, in this day and age, you can. There are multiple websites that provide lab work, and one of the best ones I could find was ultralabtest.com. That one will provide most of the lab tests for $12.95, which is pretty cheap. There's another one called Any Lab Test Now. Most other ones, you will all see that it's based on the location. So you have to go by your zip code, do a search, find the nearest place, and do it. Since I work with Dr. Say's, I have to tell you about Dr. Say's options as well. And no, nobody's paying me for this presentation. My boss has no idea that I have a YouTube channel and I do this for a hobby, to help out people. All right, so if you go to drsays.com for any visit, usually minor illnesses, don't make it a separate visit. You can ask your doctor to order the basic labs for you. I usually ask for 7 labs, and usually it comes around $79, which is not bad. It's actually better than the ultralabtest.com. And if you have a doctor ordering it, that doctor will get all the lab tests. They will review it, and if everything is good, they'll just release the result back to you and say everything is fine. If there's any minor thing, they'll just make a suggestion, this is what we need to do, and leave it alone. If there's something that is a new diagnosis and you have to start on a new medication, the doctor might ask you to make an appointment and address that. So that is another way of doing the lab test. Next, doctor visit. I work with telemedicine. Guess what I'm going to talk to you about? Doctor visit online. All my nurses who used to work for me, they used to tell me that their co-pays are about $174. When I ran a clinic, it was about the same for the first visit as well. So yes, that is very painful for somebody who cannot afford it. Also, somebody who doesn't have insurance, it's even more terrible. You can go online and see a doctor. The highest price that I could find was about $75 for the telemedicine. But please understand, if you have diabetes, you have heart disease, kidney disease, neurologic disorder, you should have a primary care physician. You should see your primary care physician once a year at least. In diabetes, I would say 2 to 3 times a year. Your doctor will see you top to bottom. They are like an extended family. What they do is prevent future medical illnesses that might need you to go to a hospital. So yes, that's a bill that is well invested. All right, so yes, you need to have a primary care physician because they will see everything as a whole: prevention of cancer, prevention of comorbid conditions, and any future emergencies. For anything else, think about after 5 o'clock. What are the good and bad for telemedicine? The goods are you can see a doctor at any time of the day, whether it's midnight, 3 a.m. in the morning, 4 a.m. in the morning. Most telemedicines have a doctor on call, so you can see them at any time. For minor illnesses, it's very easy. You don't need a physical visit, like UTI, upper respiratory tract infections, STD. Those are common. Refills, if you don't have insulin refill, then any kind of refill is very easy to do online, and you don't have to go to a regular doctor and pay a high copay. So what are the times that I do want you to see? Complex insulin prescription. Those I would rather you see your regular doctor, because we don't want any mistake, and we don't want your blood pressure to crash or go high and cause a medical emergency. So those cases, I would rather you go to your regular doctor. Now, what is the limitation for telemedicine? No physical exam. So anything that's complicated, you should not see an online medical doctor. No vitals. We cannot check your vitals. Anytime I see my patient, I always want a vital. Once I know the vitals are good, I know half my work is done. So that's something we cannot do on telemedicine. But if you have a monitor at home, please check your vitals before you get online and see your doctor. So I've already told you about how to save money on lab order and how to do this visit. One extra additional thing I have to say, since I work with Dr. Says, I have to give you the good news. drsays.com has an annual membership that they just started a few months back. And for that, the monthly fee is only $3 per month. And for that, you have unlimited visit, $25 each time. And guess what? It includes any of your children who are less than 18 years old. So one annual membership for all your family member. What I would suggest, if you and your spouse both see doctors at Dr. Says, the person who is more sicker, you do the annual membership, and maybe your husband or wife can be a regular member, and that way you can make it even more cost effective. Finally, I want to talk to you about non-emergent surgical procedures. How can you save money there? Please, gallbladder surgery, repair of hernia, appendix removal, all this can be done as outpatient. Outpatient ultrasonogram guided lithotripsy. Those you don't need to go to a hospital. If you go to a hospital, they're going to charge you for the OR. If you go to an outpatient center, they will do it as an outpatient procedure, send you home the same day with pain medication and everything. And that will be so much cheaper than going to a hospital. So plan ahead. If you have those problems, you should get antibiotic, make it stable, and then do the procedure as non-emergent. If you wait too long, you're going to run into complication, and then you won't have a choice. You'll have to go to the emergency room. Going to urgent care versus emergency room. Urgent care center, you have to pay cash upfront. Yes, for some people that is difficult, but in the long run, that's cheaper. So you can probably pay $160 to $200 for an urgent care visit, while going to the ER may end up more than $1,000. So think about those things. And more than 71% ER visits could have been handled on telemedicine or urgent care visit. That is the ultimate truth. So think about all those things. Also, when you choose your insurance, think about your family need. Do you have severe medical conditions? Think about your deductible accordingly. should you go ahead and have a lower deductible or a higher deductible? If you don't have too many medical conditions, you're young and healthy, maybe keeping a high deductible may be a choice for you, or it could be because once you do the high deductible, it also depends on the premium, right? So you have to kind of do your own research and see what works for you. If you're going to be in the hospital a lot, maybe you want to make your deductibles low so that you are going to have that insurance pay for the rest anyway. So think all these things when you're choosing your insurance. All right, I think I covered most of it. If you have any further questions, you know how to reach me. You can reach me on the comment section here. You can also reach me on Facebook as under Dr. Sattar. It is going to be Shamima Sattar, and you can send me a text message and I will touch base with you. And you know the YouTube channel is Doctor to Help. So don't forget the lottery. Remember, if you're not subscribed already, subscribe, leave a comment, and the winners are going to be announced on Sunday. So look for a notification about it and we'll go from there. It was very nice meeting you all again. Feel free to reach me for anything. I'm all here for you. Take care and have a wonderful, wonderful day. Bye-bye.